everyone. Heather Holmes here with KTB Fox 2 News in the San Francisco Bay Area. And once again, I'm joined by Dr. Rashid Chotani. He is an infectious disease expert and also currently researching COVID-19. Thank you so much, Doctor, for being here again.
Thank you for having me. It's a pleasure always to be with you on the show.
I want to talk a little bit about more states moving into reopening. We here in California are now entering our phase 2, allowing some businesses, curbside pickup, things like that to happen. How do we do this responsibly and safely?
So about 47 states are moving into some sort of a reopening of their states and the economy. Some of those states have unfortunately not seen a decline in the number of cases. There are few parameters that need to be looked at. One of them being how many tests are being performed, how many people are getting admitted to the hospital, how many people are getting from the hospital into the intensive care unit, and how many deaths are being recorded. So all of those indices, except one, has to go down. The number of testing has to go up. Now, there is a particular parameter that needs to be looked at, and I've looked at that. WHO has recommended that if you see that 10% of all the people that have been tested are positive, then you are going in the right direction. So your objective is to increase the testing as much as possible and bring down the number of positive from whatever number you've got to less than 10%. Korea has it right now at 3%, and that is a incredible achievement for them. And I believe California is also in an area where they are meeting that requirement. Their hospitalization rates, they have enough hospital capacity. That's something that I've looked at. It also has enough ICU capacity as well as ventilators. So in that particular, from that perspective, yes, you've got to think about reopening. You also have to take a look at the number of cases. And if the number of cases are going up, or you've flattened the number of cases, or they're going down now. And I believe that California is moving in the right direction in that regard. Washington State actually has done a remarkable job compared to every other state in this matter. But California is doing the right thing. Now, people talk about why do we need to reopen, and do we really need to reopen? So one of the things that we've got to do is we've got to take science and data into consideration. If we take a look at those two things and follow them through, then we should be okay. Now, right now the numbers came out that about 20 million people in the United States are unemployed. I mean, that's a huge number. And I was talking to a particular individual, and, I said, you're taking a risk, man. I mean, what are you doing? And he goes, well, I've got a family and I've got to work, and I want to take this risk. So I said, be cautious. Make sure that you are observing the social distance. Make sure you're wearing the mask. Make sure you're using the hand sanitizer. Use common sense measures if you want to take that risk. It is a risk. There's no question about it. And a lot of states where they're going to do this massive reopening are going to see a large number of cases pop up in the next couple of weeks, which is unfortunate. I hope I'm wrong, but that's what the data and the historical information that we have demonstrates to us. But that kind of brought me took me back to 1995. I was at Johns Hopkins School of Public Health, and I was doing a project in Pune, India. And we were working with sex workers who were HIV positive, had active AIDS. And the question that was posed to this lady was, why? I mean, you didn't think about that you would get it. In those days, HIV was the big thing. And she said, well, I have a little child, and when the baby was crying, I didn't have time to think about what was going to happen in 1 year. I had to make the money now. And that's such a sad fact of life. And that's what dawned onto me when I was having the conversation with this gentleman. And I wish there was a way that we as a nation could do something about it so that people don't have to take that high risk if they don't have to. We implement strategies that are critical strategies in terms of developing methodologies to screen people in an effective way so that they are comfortable, their colleagues are comfortable, and when they go home, their families are comfortable that they've not been exposed to the disease. So yes, we are taking a huge risk, but at times, unfortunately, those risks have to be taken. I hope that we are taking the right calculated risk. Each state has to take a look at their numbers and their data, and then do the soft opening. California is doing a pretty soft opening right now. They're not just going, totally, gangbusters on opening, which is a good thing. So the governor, I was listening to the governor today, and basically what he was saying was that they're going to see and then follow the numbers and see what they have to do. As I had said earlier, there might be a way that we have to take a look at this and do a phase in and phase out kind of a policy for stay home and shelter at home, etc. And social distance. Social distancing has to be there till we find, my friend, till we find and we get a vaccine. There's absolutely no way that we will have herd immunity without a vaccine. The only other way to get herd immunity is just opening everything up and then exposing everybody and taking a risk on lives. And from a public health perspective, from a perspective that I have, that is not the right way to do it.
Mm-hmm, mm-hmm. You mentioned that 10%. Tell me why that number is so significant.
Well, there's no real number out there. There's no real standard out there in terms of how many tests are required. What we've seen is that, and I was looking at the data comparing South Korea, New Zealand, Australia, United States yesterday, in terms of how many testing they were doing per 1,000 patients, and 1,000 population, sorry. It was very clear that Korea started about 4 or 5 weeks before anybody else started doing this thing. So they didn't have to do a lot of testing. They did a massive amount of testing, but not to the extent that we have to do right now, or other countries have to do right now, because we started a little late in terms of doing the work. But WHO has taken a look at it, set up a parameter that, listen, testing is being done, and from our nation's perspective, we are getting about 18%, 16 to 18% positive tests, positive PCR or diagnostics for COVID-19 right now. If we start doing more testing and the numbers start going down in terms of positivity, and once we hit the 10% threshold, and then we take it down further, that means that we are actually seeing a decrease in the number of cases. Now, there are multiple strategies that we can apply to that. I know that we have a problem with the test kits. I know we have a problem with the reagents. So one of the possibilities, one of the ways that I've proposed to multiple states right now, including some counties in your state, is to do what we call the cluster sampling or sentinel surveillance. So you set up small areas of surveillance in different parts of the county or the jurisdiction that you're in, and then test over there, and be able to find a way to see how the numbers are reflecting, because that is going to tell you what you need to do in the next 2 weeks from a hospitalization perspective, et cetera, if the numbers are going up or going down. Now, there are so many different things that are coming up. Till we get a vaccine, or we have to think about all the things that we can potentially do from a surveillance perspective, from a contact tracing perspective, and isolation perspective. All of those things have to play together for any jurisdiction to be safe and develop a resilient, essentially, community.
How realistic, though, is that sort of surveillance that you're talking about?
So currently, there are 2 surveillance systems that are already in place in every jurisdiction. There's a regular surveillance system. COVID-19 is a reportable disease. The problem right now with COVID-19 is that the state lab and some of the labs are able to report the results to the county or to the state. But there are lots of other ways the test is being done. And there has to be a uniform platform through which reporting has to be done, so that we understand exactly how many people are have been tested and how many people are positive. If you go to the CDC website right now, it will show you that about 700,000 people, well, yesterday I went on it and it says 700,000 people have been tested in the United States. Now, I know in California, you have tested way more than that number just in the state of California. So the data is not getting there in a timely fashion to reflect exactly what's going on. Again, within the count, it's being done in counties, in health departments. Then, there are other labs that are doing it. Somehow, all that data needs to flow in, and we've got to have a very robust system. Now, when I talk about sentinel surveillance, so what you do is, for example, right now we've got the minute clinics that are doing it, the testing. There has to be a particular way to get that data and then quickly analyze that data. And those centers have to be in different demographic areas, different socioeconomic areas, so you can understand what is going on in different communities. And then you can essentially, if you devise it in a statistical manner, then you can actually generalize to some extent the results that you're getting, rather than doing the entire population, because we are so resource constrained right now.
Yeah. I want to move on and talk about potential treatments. And you're closely following something that is happening there at the Mayo Clinic. Talk a little bit more about that.
So we've all talked about convalescent plasma and using that for treating patients who are in intensive care units. Now, the results are not out as yet, but the anecdotal data or information that is coming out is that there has been significant success in that area. Plus, in those patients, remdesivir has also been used initially, and then at the same time, they're getting the plasmapheresis therapy. And both of them combined together, I believe, might be able to, I'm pretty sure that it will be able to save a lot of lives that we were not able to save in the intensive care unit. So it's a little tiny silver lining that I see, and I hope that it gets bigger, because that is what we want to see in hospitals and hospital settings, especially in the intensive care unit settings.
Yeah, absolutely. And when we talk about convalescent homes, obviously those have been hit significantly hard by this outbreak.
Yes, absolutely. One of the problems that is it's a critical problem, and this comes back to testing, is that a lot of individuals who live at facilities and nursing homes, when they go to hospitals, they get better over there. But then the nursing homes are saying we need two negative tests on them. And somehow that is not possible because of some issues in terms of testing, in terms of the results getting back. And then the nursing homes are extremely worried about getting those patients back into their community, into that nursing home, so that because they want to protect the rest of them. So those are critical issues. By the way, the sentinel surveillance that I talked about, one of the places that it can be done, and I propose that, is at long-term care facilities and nursing homes, because those are vulnerable populations, and we need to take a look at that also. So you put that in an affluent area, you put that in a middle economic status area, and then in a low socioeconomic area, and then put it at places such as nursing homes, and have some hospitals do it. And then you can get a much better idea as to what's going on. But we've got to come up with innovative ways to do all of that, and come up with new ways of doing it. And if I have time, I'll talk about something that I feel that potentially can help do some early warnings as to what's going on in the community.
Okay, well, let's go ahead and talk about it. What is it that you would like to see?
So here is a crazy notion, right? So we know that there is the virus is excreted to the fecal route, and there's viral shedding in feces. Thus, the wastewater system is another source where one can test the wastewater to see, if there is virus present over there. Now, again, this is a novel concept. I think one of the universities in California, not too far from you guys, is looking at some of the historical water samples from the waterway system to see if they can identify it. Now, if it is possible to identify it, then, because that people don't get symptomatic for about a week. After a week, you get symptomatic once you get infected. So during that week, also, you're doing some viral shedding. And if you're doing it through the fecal route, which has been clearly demonstrated that that happens, we don't know exactly what percent happens. We still need to do a lot of research on that. But that is another way, if we can look at this unusual way of doing surveillance. So that's something that I think people are looking at right now. And I believe that we'll find out if this is a useful way of coming up with some way of doing early warning by looking at the numbers and the concentration of the virus in the wastewater system.
Obviously, we're sort of looking at every possibility
Yes.
at this stage. As we begin to wrap up, I want to talk with you though about what you think hospitals can do, what needs to be done to sort of bring everyone up to speed on testing, and also again on surveilling people who may have this or may not, and kind of working everyone together to help other counties and areas reopen.
So again, the most important thing is testing. We've got to come up with a point-of-care diagnostic, whether it's a PCR or it is a serology test. We have to come up with that. Now, and it has to be inexpensive. It has to be affordable so that everybody can, as many people as possible can get it. Now, we know that this virus doesn't discriminate. Unfortunately, we've seen that White House has been affected by that right now. And it is, for me, irrespective of what your political affiliation is, I think the leadership of a country needs to be protected and safe. And it is very important that the president and vice president are healthy because they are the decision makers right now. And they have to make sure that some very critical decisions are made, and they need to be as healthy as possible. So we know that it can touch anybody and any place. So what we need to do is to come up with a strategy which has a good testing ability. Today, FDA approved a saliva kit that is a home saliva kit for identifying if you have or have not the COVID-19 or SARS coronavirus 2. It is a great step in the right direction. Now, that is the only way that patients will be able to do that is that their physicians have to order that test for them, and then the test gets to them. They can do it at home and then send it back to the lab. There's a process that's involved in it, but it's still going to be, it's not very clear as to how this is going to happen. But just today, just about, I believe a couple hours ago, FDA approved a saliva test, which is a home test, which is, again, a remarkable thing. Those are the kind of things and innovations that we need. In hospitals, we've got to find a way to test and clear everybody that works over there so they are comfortable working over there. We've got to set up a system, invest as much as possible in healthcare professionals because they are the front line workers. We need them. We cannot live without them, in all honesty. If I get sick, believe me, I cannot live without having somebody taking care of me in the hospital, the nurses, the staff over there, the physicians. I mean, it goes from the person who works at the door over there, the guard, all the way to the president of the hospital. We need everybody, all of them healthy, and they need to be tested and they need to be cleared so that they're comfortable working in that capacity. Hospitals obviously are reporting all the cases to the state departments. So surveillance is good over there, but there has to be a clear platform, easy platform for them to do the reporting. And I think that is something that we still need to work on.
Yeah. And finally, last question, again, as more places start to reopen, your biggest point of concern. Obviously, they need to social distance. Most people are wearing masks. But what else do you advise? And again, what is your biggest concern with more states reopening?
So again, everybody's got to keep the social distancing. Everybody's got to wear the mask, irrespective of whether the state tells you to wear it or not. If there are people who are not wearing it, it's their choice. But as many people as wear it, I would say, please do. I wear the mask all the time when I go outside. Make sure that you have hand sanitizer. Make sure you have something that you can clean your hands with as quickly as possible once you touch surfaces. Make sure that you don't have to, if you can, I mean, I'm all for restaurants, okay? And all these places. I don't want them to go out of business. My sister has a restaurant, and I know how difficult it is for her in these times. And she's been there for about 12 years now, and this is the first year that she's having a very difficult time. Worse time than when she first started, because most of the restaurants have the most difficult time when they start. It's an established business. She's having a very difficult time. So I'm all for that. So if you can go and carry out, do carry out. If you go and sit over there, make sure that you're sitting at a distance. Do not, take a risk yourself, and do not put anybody else at risk. So and we all have to work together over here. We all have to work as one society. Please make sure that you're not putting anybody else at risk because of your behavior, if of your way of thinking. You have to think for the entire community. As a nation, we have to be strong and we have to work together, and that is the most important thing. Again, if you can work from home, do work from home. If you can do all the work that to be honest about it, I work from home, and to be honest about it, I work more now. I'm not working all the time from home, but part of my days from home. But I'm working so much I can't even imagine right now in terms of working out of home. So work at home. Make sure that you keep your family secure and safe. That's all it is. I come home from outside, I go straight to the bathroom, take my shoes off outside, go to the bathroom, take a shower, put all my clothes in the laundry, then wash my hands, and then go and see my family. This has become a normal routine. Let's make that the normal routine. It's a good routine, by the way. Actually, I'm cleaner. So hey, do that. And it's good for your health yourself. Personally, it is good for you to be to have that hygiene. Now, all the people that are working out of home, I was on a telephone conference at 8:30 in the morning. It was not a telephone conference, video conference. And everybody said, "Oh my God, you're wearing a tie?" And I said, "Well, I get up every morning. I take a shower. I shave. I put on a nice shirt. And I put on a tie or a bow tie, whatever I feel like doing that day. Because what that does for me is that disciplines me. Because that disciplines me that I have to do the work and I am still alive. I still look good. I still feel good. And you've got to do that in order for you to survive this thing."
Yeah, really important advice. Well, always a pleasure, Dr. Chotani. Thank you so much for taking the time to talk with us.
Always a pleasure to be with you. Thank you so much.
Thank you.